The pyramid model is a framework. It's a framework for how to go about teaching children social emotional skills and meeting the social emotional needs of children. When children learn social emotional skills when they're very young, it will help them in everything they do. It's going to help them not only go to school and be successful in school, but be happy. And when people are happy, they thrive.
So we teach arithmetic, we teach writing, we teach all these things, but we don't teach kids how to manage or label or identify or deal with their feelings and emotions in appropriate ways. We expect them to just figure it out. The pyramid model creates a set of practices and structures that allow families and teachers to help their children understand the dynamics of social emotional development and figure out how to manage those day-to-day interactions in appropriate ways. We know from research that when we apply the different evidence-based practices and strategies that comprise the framework, that within the base tier, which looks at supportive in relationships and predictable environments, that about 80 to 85% of behavior issues and concerns are resolved just by making the environment predictable and reinforcing and safe for kids. When we look at that center tier, or that one that looks at teaching specific skills, we can resolve about another 10 to 12% of those behaviors and issues just by specifically teaching a child, here's how we sit, or how to move from one activity to another in a way that is acceptable to everyone else around them. And so we can resolve those, which leaves only about 3 to 5% of those kids at that top tier that need additional interventions or additional supports that the rest of the children wouldn't necessarily need.
Mental health consultation, when you bring maybe a mental health consultant or an early childhood specialist in to consult about a specific child, it really only deals with that specific child. In the pyramid model, that it really talks about what is good for all children. And many times if you implement what is good for all children, the children who are experiencing some difficulties benefit from that. And then you might need to give them a little bit extra support around specific areas that are within the pyramid model as far as relationships or their different strategies around social skills. But you get more out of implementing the pyramid for all children rather than it just really focusing on one child at a time.
When we provide adults with training and then coaching on how to implement what they've been trained on and how so they can continue to grow professionally, that is what makes the biggest difference. I see children who really struggled, who really had challenging behavior to get what they needed, grow into children who are able to say, can I have that when you're done? Or if they're really little, next, instead of going over and hitting someone to get what they want. That's the most fulfilling thing.
We're very lucky in Nebraska. We have a state leadership team that's comprised of a bunch of different entities and groups that are interested in promoting the pyramid model and supporting the social and emotional development of our youngest children.
In Nebraska, the pyramid model is being implemented in a number of different ways and in different populations. So Rooted in Relationships is implementing the pyramid in both child care centers and homes in certain communities in Nebraska. And at the same time, Nebraska Department of Education is implementing the pyramid model in some pre-K settings across Nebraska that are connected with their schools.